So I'm in the operation theatre. I'm in my operation theatre basic dress, which is just washed and sterilized pajama and kurta, a mask and a cap. And now I'm going to start preparing for the operation. First is the hand wash and hand preparation. So in a hand wash, I operate the tap with my elbow. And I use, first wash my hand, use a antiseptic solution. I'll just use some water from here. And I have to apply this over my hands and on the arms up to the elbow. Now when I do this hand wash technique, we have a poster here which tells us exactly how to do a hand wash. So first steps of hand washing. First step is palm to palm. That means this is palm to palm. This is what we normally do. Anybody does when he washes a hand with soap and water, is the palm to palm cleaning, right? Then is between the fingers. So then this is between the fingers, because dust can collect in between or contaminants can collect in between. So this is between the fingers, right? Then is the back of the hand. So the third one, back of the hand, like this, and back of the hand like this. Then the base of the thumb, the base of the thumb like this, base of the thumb like this. Then back of the fingers, this is the back of the fingers, so like this, back of the fingers like this. Then fingernails, because a lot of dirt, mud, infection gets held up in the fingernails. So there should be no fingernails. That means there should be it should be cut and trimmed properly. And then we rub the fingernails on the palm of the hand. One side, the other side. And then we come to the wrist. And after this, I come to the rinsing part. So now I am rinsing, and when I rinse, I have to be careful that the water should not flow from my elbow where there could be some contamination towards my hand, but it should flow down from the hand to the elbow, right? So all movements are from the hand towards the elbow. So once I pick this up from here, washing my hands, and then the movement is from the hand, this stays up like this, to the elbow, right? And once this is complete, now I can use a hand towel to clean and wipe and dry my hands. And this starts from my hands and down towards the elbows, so that I don't bring infection from the periphery to my hands. So the direction has to be always one. Now this side I've already used. So for the other arm, I'll be using the outer side. First the hands, and then down from the hands towards the elbow. This done, the second layer of antiseptic is this sterillium, which is an antiseptic solution, something similar to what you have seen during use of COVID times, where you use alcohol to sterilize your hands. So after putting this on my hands, I dry, and only when I dry does this alcohol become effective. So this is 70% alcohol, similar to alcohols you have used during COVID period to do asepsis or to sterilize your hands. So drying is a must. It's only when this solution dries up that it becomes antibacterial and antifungal, and it kills all these contaminants on the hand. Then the next layer is a sterile gown which has already been autoclaved at a temperature of 135 degrees for 5 minutes. So there are always certain situations in surgery where you have to take extra precautions in the operation theatre. The extra precautions are to be taken in cases of HIV, which is called AIDS, other viral conditions like Hepatitis-C, Hepatitis-B, and in these situations we use extra precautions. So this is the kit for extra precautions, which is kit called Medical Body Protection Premium. Now when I open this kit up, I'll just show you the contents. So once I open up the glove, this is marked. R is for right, L is for left. I open this up and pull on the right glove first. Now this is the inside of the glove. You can see there is a fold here. This is the outside of the glove. So I hold this and pull it on my fingers, and from this edge I pull it up on the sterilized cuff of the gown. So at all times I am not touching the outer side, because this side is going to come in contact with the patient's body or the eye. Now I hold the other one, and now since this is sterilized, I have to touch it to the sterilized area only and not the inner side, which is going to touch my hand. Get this into position and pull the glove over the cuff. If you notice, my fingers with the sterilized glove are on the outer side of the glove now, not on the inner side. So my glove is in position. This is stage 1. This is a routine preparation for any surgery or eye surgery. Now when I am doing some high risk cases like cases of HIV or AIDS or Hepatitis B or C, I need an extra layer of security for both me, my staff, and for other patients. One such patients are done as the last surgery of the day in that operation theatre. After that, the operation theatre is closed, refumigated, sterilized, and then used for the next day. So we are opening up the kit now, and in this kit these are foot covers so that my foot is not soiled or infected by the fluid which is coming from the patient's body or eyes. A mask, I already have a mask on. These are some goggles which are protective goggles. So these goggles will be worn over my goggles so that any cheetah or any spill does not hit my eyes and infect me. Then we have these 2 sheets. This one sheet will be a drape on the bed below the patient, one as a drape on over the patient, so that our OT does not get infected. Okay. Now once the patient lies down there, we cover the patient with another sterilized drape like this. Okay, now I use the second layer of security. I use a gown over the first gown so that in case some dangerous virus or bacteria goes through my first layer of security, it gets stopped at the second layer of security. And then I am taking this one ribbon out in one hand, and the other ribbon has to be tied by me. So my helper helps me, and I tie this ribbon here, and so my second layer is in position, right? Now I need to have an additional glove over my normal glove. So if my normal size was 7, another 7 will make my movements tight, and I will find it difficult to move my fingers and operate. So I need one size higher than the normal glove which I was wearing. So I wore the 7 number before, so now I'm going to wear the 7.5 number. The same process. So this is the second layer of security for my hand. Now I'm going to use these glasses as a security for my eyes. So these are plain glasses but protective glasses, so that any splash from the eye or the body or any of this infected fluid does not touch my eyes or body. Now my feet are still exposed and I need to cover them. So these are the covers for the feet. So these long covers. This covers the foot area, and this has to come up till just above the level of my knees, so that it doesn't slip down. So I'll have to sit here. So my helper this is the first cover in position, and with this I am ready to start my surgery. So now the derobing process, that means all these points I assume are contaminated with the body fluid or the eye fluid of the patient, and they should not be touched anywhere, and they should be disposed of in a very safe way. These sheets are going to be wrapped around, and the infected side inside, the clean side outside, and this will be put in this sterilized pouch which came with the kit. Now my glasses goes in the kit, my outer gloves goes in the kit. Now my gown has to be opened up. This is the outer layer of my gown. I'm touching from the inside, not touching from the outside. The sleeve is getting turned inside out. And then now the inner side is the cleaner side. So we wrap it around, the cleaner side outside, the contaminated side inside, and it goes into the kit. My shoe cover, I'm taking it off. The same way, clean area outside, contaminated area inside. Again, clean area outside, contaminated inside. The outer layer of security has been taken care of. Now the inner layer, my gloves, inner layer glove is taken care of. My inner layer gown is taken care of, and I am now in my normal operation theatre clothes. And now the most critical step. All the soiled material is in this sterile bag, and this sterile bag has to be sealed before it can be given out to the people who collected biomedical waste, it is called. So biomedical waste collection system. So this is the biomedical waste. Now we are sealing the bag. So this is now sealed. So like this, it will go to the biomedical waste collection system. And now this operation theatre will be fumigated and will be ready for use tomorrow morning. Thank you. And this is Dr. Sanjay Chaudhary from I7 Daryaganj.